Hello, everyone, and welcome to today's session on cooking with gas, the health harms from gas stoves. My name is Zach Williams, and I am the health educator and campaign coordinator for the Environment and Health Program with the Physicians for Social Responsibility National Office. I'd like to thank you all for joining today's presentation and for your attention over the next 45 to 60 minutes. And I'd also like to thank Dr. Barbara Warren and everyone at PSR Arizona for hosting us this evening. First, some logistics. As I begin and continue with the presentation, please drop any and all questions into the box labeled Q&A at the bottom of your screen. At the end of the presentation, I will be going through each of those questions, and please be sure you input them into the Q&A box and not the chat, as I will be monitoring the Q&A box at the end. If we run out of time and we do not get to your question, please feel free to email me. My email is on the screen, and I will also drop it in the chat right now for everyone. And I will be happy to continue the conversation and answer any of your questions over email. There you are. Alrighty, without further ado, let's jump right in. So first, I just want to give a little introduction and a brief overview for who PSR is. I'd like to introduce the organization today. So Physicians for Social Responsibility is a national nonprofit founded by physicians with 33,000 members and e-activists. It was founded with the mission to protect us from the greatest threats to health and survival. Today, PSR mobilizes physicians and health professionals to advocate for climate solutions and a nuclear weapons-free world. We contribute the critically important health voice to energy, environmental health, and nuclear weapons policy at the local, federal, and international level. Next, I want to just outline what this training is going to be today. So by the end of this hour, you participants should be able to articulate how cooking with gas appliances produces dangerous indoor air pollution and explain the health effects of each pollutant, be able to recognize and prioritize vulnerable populations as well as understand why they are vulnerable. And 3, address the health effects of gas stove pollution and explain to your family, your patients, your loved ones, the steps they can take to reduce their risk. Today's presentation is CME and CEU accredited for physicians and nurses. I don't know if we have any in the audience today, so I will just glance right over this. This is just a lot of words saying we are accredited, and this is a paragraph telling you that I am not selling you anything. Alrighty, so before we jump into the content, I do have a small ask for you all. If you could please fill out this quick pre-test. It's about 5 or 6 multiple choice questions. If you have a smartphone, you can either scan the QR code on your screen, or I did just drop the form to the Google survey in the chat. So I will give us about 2 to 3 minutes to fill out this form, and then we will reconvene about 3 minutes from now. Thank you so much, everyone, for filling out that pre-test. And now, before we jump into the content, I want to have a little bit of engagement with the audience here. So first, a question for our group today. What's the first thing that comes to mind when you think of gas stoves? You can throw it in the chat. You can raise your hand and I'll unmute you if you have, to call out what you think. What's the first thing that comes to mind when you think of gas stoves? Better cooking. Sure thing. You can boil water in like 25 seconds. Cooks love it. Sure, dirty ceilings. Absolutely. Fire danger, absolutely. There's some risk of injury with gas stoves. So it seems like we have a mix of positive and negative connotations when it comes to gas stoves. Something that always comes to mind when I think of gas stove is that colloquialism we have in the United States, cooking with gas. It's a positive thing. Your car won't turn over, and then finally it starts, and now we're cooking with gas and can get on the road. So it means something good. And that is due to the part of the oil and gas industry for the past 50 years using the term cooking with gas to make sure that we think that is clean, healthier, and better than electric stoves. However, no matter how you feel about gas stoves, the fact still remains that cooking with gas on a gas stove without ventilation produces dangerous amounts of indoor air pollution, which leads us to the first section of this training, which is understanding the pollutants produced by gas stoves and the health effects they have on the human body. The primary pollutants that are produced by gas stoves include nitrogen dioxide, carbon monoxide, and particulate matter, including both PM 2.5 and PM 0.1. PM 0.1 is also known as ultrafine particulate matter, if you've ever heard that phrase as well. Let's jump right into what these air pollutants do to the human body. First and foremost, let's start with nitrogen dioxide. So nitrogen dioxide is a harmful air pollutant that is produced by the combustion of fossil fuels, including methane, which we burn in our gas stoves. NO2 contributes to the development of asthma, aggravated asthma, and increased susceptibility to respiratory infections. It is also associated with negative general cognitive functioning. Next, carbon monoxide is another dangerous gas, and perhaps it's more well known than nitrogen dioxide. Exposure to carbon monoxide can have neurological effects such as fatigue, impaired vision, dizziness, all the way to falling into a coma. For cardiac patients, carbon monoxide can also cause chest pain. At high enough levels or long enough exposures, carbon monoxide can also, of course, lead to death. Lastly is particulate matter, both PM 2.5 and PM 0.1. For context, PM 2.5 means any matter that is smaller than 2.5 microns, which is an incredibly small particle that will coat and lay on the inside of your lungs. PM 0.1 means any matter that is smaller than 100 nanometers, which is even smaller than PM 2.5, which means that it can actually get directly into your bloodstream from your lungs or through your sinuses. So what does PM 2.5 and PM 0.1 do to the human body? They can aggravate asthma, decrease lung function, and increase respiratory symptoms. It could also contribute to non-fatal heart attacks, irregular heartbeat, and premature death in people with heart and lung disease. PM 2.5 and PM 0.1 have an asterisk next to it because the amount of particulate matter that is being produced varies based on what is being cooked in the pot or the pan, and particularly fats and oils like the canola oil and the olive oil that we use to pan fry food particularly contribute to the most particulate matter. Now, this is what all of these air pollutants do to the human body, but how much are we actually being exposed to them? So let's look at some exposure data real quick. Pardon me. Gas stoves produce so much nitrogen dioxide that their indoor emissions often exceed outdoor standards. On the left here, you'll see the national standards and guidelines relating to nitrogen dioxide concentrations. The United States does not have standards for indoor air pollution, so we use the outdoor standards as a reference. As you can see here, the US EPA national outdoor standard is 100 parts per billion over 1 hour, and the World Health Organization's outdoor standard is 106 parts per billion. For context, 1 part per billion is like adding a single drop into an Olympic-sized swimming pool. So again, very small amounts of very small concentrations of these pollutants, the EPA is saying you should not be around them for longer than an hour. Now, data from the Lawrence Berkeley National Laboratory showed that in houses that were less than 1,000 square feet, indoor air levels of nitrogen dioxide exceeded the standards more than 83% of the time when folks cooked on a gas stove without ventilation. And this goes up to exceeding the standards 100% of the time in homes that are smaller than 1,000 square feet. So from these data, we can see that using a gas stove without ventilation produces dangerous levels of air pollution. And let's look at this graphically to see what this looks like visually. Here's a graph I pulled from that Lawrence Berkeley National Laboratory study. Here on the x-axis, you can see time of day. So this is each cooking function the researchers were performing on the gas stove throughout the day. On the y-axis, you can see here is NO2 concentration in the air. And right here, this 100 mark is 100 parts per billion, which is the EPA outdoor standard. So this line here, the EPA says, if you're around anything higher than this for more than an hour, it's dangerous. And what we can see here with this red line, which is the measured NO2 concentration in the kitchen, and then this blue line is the measured NO2 concentration in a hallway or a bedroom farther away. In this house, which is a small home with a gas stove without proper exhaust or ventilation, so kind of the worst of the worst, you can see here that with each cooking function, the researchers measured that these NO2 concentrations were above this limit, no matter what cooking function was happening. So now we can see visually that yes, using a gas stove produces dangerous levels of nitrogen dioxide. But what does that mean for our health? How does that dangerous level of nitrogen dioxide impact our health? So let's zoom into a case study and specifically look at childhood asthma. So here is a study entitled Association of Changes in Air Quality with Incident Asthma in Children in California from 1993 to 2014. This is a multi-level longitudinal cohort study over 21 years, which all you need to know about that is that this is one of the best forms of research methods to look at effects over time. So over here, we have, if we look at this graphically again, over here on the graph, we have the x-axis is nitrogen dioxide concentration again, but if you see it's flipped. So we have high concentration over here, low concentration over here. And over here on the y-axis, we have the asthma incidence rate. So this is the amount of childhood asthma that we're seeing in primarily Los Angeles. Each of these different colored lines is a different community within the Southern California area, primarily around Los Angeles. And as we can see over time from 1993 to 2014, when Los Angeles got its act together and started to clean up the air and clean up the smog that was surrounding the city, as they cleaned up the air and decreased the level of nitrogen dioxide, they also saw decreased levels of childhood asthma. So this is showing that when you decrease nitrogen dioxide, you can also decrease the amount of childhood asthma that you're seeing. And the focus on children is particularly important as we go into the next section of this training, which is looking at vulnerable populations. Children are one of the most vulnerable populations when it comes to gas stove pollution, and this is for a couple of reasons. First, children tend to have higher breathing rates. Next, children have higher lung surface to body weight ratios and smaller bodies. So an NO2 concentration that could be safe for an adult could be harmful for a child. And lastly, children's immune and respiratory symptoms are still immature and developing, and they don't have the ability to deal with stressors in the same way that adults can. Now, I want to continue the conversation about vulnerable populations, but looking at it from an environmental justice perspective, because this is also a health equity issue as well. Now, continuing to look at childhood asthma, there are health disparities when it comes to the prevalence of childhood asthma within different communities. I'm about to show you a lot of percentage points, and I'm not going to say every single one that's on this slide. But these data come from the National Center for Environmental Health and the Journal for Urban Health. First, let's look at housing type. So compared, 21.8% of children living in public housing deal with asthma compared to just 7.38% of children living in private residences. Next, when we look at race or ethnicity, the prevalence of asthma in Puerto Rican children is almost twice that of white children, and the prevalence of asthma in Black children is more than twice that of white children. And lastly, looking at income level, 11.8% of children living below the poverty line deal with asthma, compared to just 5.9% of children who are living at 450% of the poverty level or higher. So living in a non-private dwelling, being Black, and living below the federal poverty level are all risk factors for childhood asthma, one of the most prominent health effects from gas stove use. And why is this? Again, part of the second learning objective is to understand why these populations are vulnerable as well. To fully understand why being a person of color or of low socioeconomic status puts you at higher risk for respiratory illness from gas stove pollution in the United States, we have to look back at our history. First, federal housing and transportation policies essentially codified racism and prejudice into the economic and geographic development of the United States in the mid-20th century. First, the Federal Housing Act of 1949 authorized the demolition of Black neighborhoods. And next, the Federal Aid Highway Act of 1956 authorized the demolition of urban neighborhoods which were labeled as urban slums and replaced them with the nascent interstate highway system. These urban slums were often folks of low socioeconomic status or communities of color. This not only severed communities, which were most often poor or Black neighborhoods, but also constructed long-term polluting transportation infrastructure next to, near, or through communities of color and poor communities. Secondly, although it's outlawed today, many majority Black and brown neighborhoods are still reeling from the effects of redlining. Redlining is a homeowner's loan corporation categorization strategy where some neighborhoods were labeled as high risk whose residents should not be given access to mortgage loans. These neighborhoods were outlined in red on the homeowner's loan corporation's maps, which is where the name redlining comes from. However, today, redlining now refers to lending discrimination that bases credit decisions on the location of a property to the exclusion of characteristics of the borrower or the property, where the property is, how the property looks, and who the borrower is. Redlining prevented investments in infrastructure, green space, public transportation, business development, and all other aspects of city planning that make for a successful and prosperous neighborhood. Because banks refused to give loans to Black Americans decades ago, their descendants now deal with increased levels of air pollution and a lack of political will to competently and systemically address these issues. And when I say lack of political will, that is certainly not on any of the citizens that are living within these communities, mainly the folks that have the power to turn those levers and do something on a systemic level. Next, I want to continue the environmental justice conversation, but this isn't also just about race. It's also about class and socioeconomic status. So this is a health equity issue, and lower income households are at higher risk of being exposed to high levels of gas stove pollution. And why is this? First, smaller unit sizes. It's important to remember that homes that are less than 1,000 square feet exceed the outdoor standard for nitrogen dioxide 100% of the time when you're cooking on a gas stove and have no ventilation. Along with smaller unit sizes, there are also usually more people per home in lower income households. So there are more folks using the kitchen, and there are more people being exposed to the pollutants that are coming from the kitchen. Next, low-income families are also more likely to live in older homes and have less control over the maintenance of their appliances. Older homes may have gas stoves that haven't been properly adjusted, or may even still have a pilot light, and are more likely to have inadequate ventilation over the stove. Having a cooking appliance with a pilot light means there is methane burning constantly in your home. It might be smaller than that full gas burner, but there is still methane being burned. Now most gas stoves use a spark mechanism to spark the flame, but in an older home, there may still be a gas stove with a pilot light. Next, low-income homes are also more likely to use stoves and ovens for heat. Homes with inadequate ventilation, poor landlord management, and poor insulation make families in these situations turn to the most readily available source for heat for relief, which is usually their kitchen oven, which does provide relief and it does heat the home. However, it is also pumping the home full of these air pollutants that we've been talking about this past session. Next, low-income homes are also more likely to have higher exposure to outdoor pollution for all of the reasons I said on the previous slide. When we built those permanent transportation infrastructures, especially in urban areas, they often pardon me, they often become parking lots. And so car exhaust and diesel is just all around these dense urban neighborhoods where lower income folks tend to live. So they're also exposed to higher levels of outdoor air pollution. Finally, lower income households are also more likely to have a greater asthma burden already for all of the reasons that we talked about on the previous slide, making them more sensitive to lower levels of nitrogen dioxide. Now, I just threw a lot of depressing information at you. But before we get to the solutions portion of this presentation, which of course is the meat and potatoes, never present a problem without a solution, I have another question for the group. So even if you're not a professional who sees patients, change this question to, have you ever seen any of these issues in your family, in your own personal life? Have you ever felt the possible health effects of using a gas appliance in your home? You can, again, throw it in the chat or raise your hand and I will unmute you and you could give us a shout verbally. Even if none of us in this group have seen this firsthand, I'll give a personal anecdote. It's anecdotal evidence. It's not, scientifically controlled study evidence. But there's a colleague of mine who explained to me after seeing this presentation that she used to have a gas furnace and she lives in the San Francisco Bay Area. And every winter, her asthma would get incredibly bad and her wheeze symptoms would also start to get incredibly bad. And it would be difficult for her to breathe during the winter because the gas furnace is heating the home, of course. But also, I know we're talking about gas stoves here. The same applies for most natural gas appliances, for all natural gas appliances, I should say. And recently, within the past couple of years, she has switched to an electric furnace. And she's noticed that in the winters, her asthma and her wheeze does not get as bad as it used to, if it gets bad at all, which is, again, a personal anecdote, but just the switch to an electric appliance relieved some of her respiratory symptoms. I see we have Eileen in the chat. Doesn't mean, even though you haven't seen it personally, doesn't mean that someone in your home was sick. It was diagnosed because of something else, not because of the gas. Correct. This is, and we'll go through that when we talk about solutions too, where a lot of these health effects tend to be vague symptomologies, wheeze, cough. It could be allergies. It could be the outdoor air pollution. There's a ton of confounders here, but we do have scientific evidence that yes, the air pollutants that are coming from our gas appliances do impact our respiratory and neurological health poorly. Alrighty. So in that case, let's jump straight into the, oh, Barbara, of course. Barbara, please. You might just need to unmute yourself, Barbara.
I'm sorry, that was a mistake.
Oh, no worries at all. Alrighty.
I'll try to figure out how to lower it.
Sure, no worries. You got it. Okay, folks. So before we get into the specific solutions that are available, I want to talk about solutions for a moment. So to properly address this complex health issue, the solution should also be multifaceted and systemic. First and foremost, the solution should address the target health effects that these folks are experiencing and be within feasible and correct medical practice. Ideally, the solution should also incorporate and acknowledge the living environment of the folks that are experiencing these symptoms and should aim to improve the quality of that environment. The intersection of these three core aspects is the ideal, perfect situation. However, we all live in reality where things are hardly ever perfect. So to that end, let's jump straight into the solution part of this presentation. Now, here, when it says risk assessment, this is mainly for folks who see patients, but I do just want to run through some vulnerable populations more than we have already talked about, and some at-risk behaviors. So real quick here on the screen, our vulnerable populations include children, the elderly, folks with diabetes, people of low socioeconomic status, people dealing with obesity, and folks with pre-existing heart and lung conditions. As well, there could be some behavioral risks as well that could put you at risk for gas stove exposure or for increased susceptibility to the pollutants from a gas stove. Hobbies such as running. Do folks run outside in an area with a large amount of outdoor air pollution? Do they even use ventilation? Do they have access to ventilation? Does their gas stove have some kind of exhaust hood or vent hood for the pollutants to go away? Do they smoke? Of course, smokers are going to have some degradation in their lungs and be more susceptible to air pollutants. Do they use fossil fuels inside the home? Do they use a gas stove? Do they have a gas appliance even? What's the time spent in heavy traffic and in-car behaviors? Because again, as we spoke about before, that car exhaust is also pretty dangerous to our lungs and could put us more at risk for feeling those gas stove pollutants more so. And of course, living near an industrial or fracking site, the pollution coming from those would of course also degrade the integrity of your respiratory system and put you more susceptible for feeling these gas stove pollutants. Next, for the next slide is risk management, and I'm going to skip through the patient level because I don't think we have many folks who see patients in this room, but I do want to talk about the policy level because this is where concerned citizens and policy folks really have the power to make change. And specifically, I want to talk about local, county, and state legislators. There are a lot of initiatives dealing with housing stock and building electrification that come at the local level. This is not going to come federally anytime soon, and it's also incredibly hard to work through a state legislator for something statewide. So what we're seeing across the country is a lot of individual cities are taking this up as a cause they want to address. And it's because concerned citizens and groups like PSR are advocating for that and meeting with their local and county legislators and local and county elected officials to say, hey, this is something I care about. This is something I'm concerned about the health of me and my family. Please, let's do something about this. And this is something that is incredibly important when it comes to things like this, because of course, there's the individual solution of ripping your gas stove out of the wall and replacing it with an electric appliance. But to really address the large scale systemic problem of not only methane gas harming our climate, but also methane gas harming our health, it needs to come from a policy-wide solution. So that's my pitch to go talk to your mayor, go talk to your city council and say, hey, I want to talk about building electrification and make sure that we don't have any new gas connections in our homes or commercial buildings. Now, apart from this large policy change, of course, there are some individual steps you can take to reduce your risk of exposure to gas stove pollution. And let's go through this slide now. I'll go through each one of these bubbles. So first and foremost, you can install and maintain a carbon monoxide detector. They're pretty common. You may already have one in your home, but there's a PSR member that educated me actually about the carbon monoxide detectors that we have in our homes often only go off when carbon monoxide is at a fatal level, when it's dangerous enough for someone to die in the home. The levels of carbon monoxide we're seeing from gas stoves aren't going to kill you instantaneously, but over time, they're going to really harm the integrity of your cardiovascular and respiratory symptoms. So if you want to install and maintain a carbon monoxide detector, I would say be sure to get one that is a low level monitor that would go off when lower levels of carbon monoxide are detected, not just the fatal levels. Next, if it's available, run your exhaust hood while you're cooking with a gas stove. It might not be available, you may not have an exhaust hood, or you might be like me And I have a gas stove in my apartment, but my vent hood is my microwave fan that simply blows the exhaust over my head and into the rest of my kitchen. It's not perfect, it doesn't put it outside, but it certainly does get that airflow going so that the air pollutants aren't stuck directly right in front of my face as I'm cooking. Next, I'm going to skip down right to here is cook on the back burners, because this has to do with the exhaust hood. When you cook on the back burners, the pollutants are much more likely to be caught by the exhaust hood, as opposed to cooking on the front burner, where they're much more likely to simply spill out into your kitchen. Next, this is one of my favorite ones because it's free 99, is open a window while you cook. It is probably the easiest form to get ventilation, because gas stoves, and gas stoves in particular, legally do not have to have an outdoor exhaust connection. So we have to make our own. So if you open a window while cooking, it's the simplest way to increase the amount of ventilation in your kitchen. Now, as a lifelong New Yorker, I understand that I'm a little biased with opening the window because, of course, if it's wildfire season, if it's, you know, an incredibly extreme heat day in Arizona, you might not want to open up your window and let all the AC out, you know? So in that case, if opening the window isn't a solution that we want to take, I would also say use an electric appliance like a toaster oven, a kettle, an air fryer, any kind of plug-in, plug-out electric countertop appliance that would reduce the use of that gas range. Anything to not turn on that gas burner. If you're looking for that pan fry function on a burner, but you still don't want to use your gas range, I would also suggest trying a plug-in countertop induction burner. Again, I'm not trying to sell you anything, but I've done my own research on multiple online retailers. Single induction countertop burners go for around 60, double induction burners go for around 120. I know it's a pretty penny, and certainly after these past couple years, no one is in position to, you know, think about replacing an entire appliance. However, it's an option if some of the other ones aren't available. Now, the root cause of this issue, though, is the use of that gas oven and the gas stove. The root cause solution would be to replace that gas stove with an electric induction stove. Now, I want to give a little bit of a spotlight to the induction stovetop, because I know we may have these horror stories in our minds of electric stoves, those resistance coils that got screaming hot, but only after like 84 minutes, took forever to boil water. They kind of smelled bad. But now, thankfully, there's been some wonderful improvements to electric stovetop cooking in the 21st century. And that comes with induction stovetops. And, you know, they're great for a myriad of reasons. One, they're electric, so there's no indoor fossil fuel pollution. Now, granted, I do know that the majority of energy in the United States is generated by the combustion of fossil fuels, but luckily for Arizona, y'all have done incredibly well with expanding your solar stock. So you don't have to feel as bad, again, switching to electric, because there is increased renewable energy electricity generation as well. Next, it lowers household accident risk. And this is because of how induction stovetops work. They work through magnetism, actually. An electric current is put through a coil, which generates a magnetic field around the burner. And that magnetic field interacts with charged particles in the pot or the pan, and the resistance to that magnetic field is what makes the pot or pan get hot. And I know we had said before, you know, it's gas stoves are great for cooking. Chefs love them because you can, you know, be more accurate with the heat you're getting. The induction stovetop can be as accurate to the degree. So if you're trying to sous vide something to, you know, exactly 186 degrees Fahrenheit, the induction stovetop can do that. And it lowers household accident risk because only the pot or the pan gets hot, not the appliance itself. So if you have a little one who's grabbing and touching and they reach up and touch the stove, they're not going to burn their hand on an incredibly hot gas range because it's only the pot or the pan that's going to get hot. Don't let the little one touch the hot pan, but the entire appliance itself is not going to get screaming hot. And next, it's an investment in your family's health. Just like I said, I know not everyone is made of money, especially after these past couple years, but replacing the gas stove with the induction stovetop will improve the health of your family if your family is experiencing respiratory symptoms. And again, if ripping that gas stove out of the wall isn't a possibility, those countertop single burner or double burner induction burners are a great mitigation for this. And again, you might not even be, it might not even be possible to change that appliance because you may be a renter like me. I certainly can't go to my landlord and ask him to switch out that gas stove. So the countertop induction burner as well is a great mitigation strategy if you can't replace the entire appliance. Before we get to the Q&A portion and wrap us up, thank you again so much for listening to me talk at you for the past 40 some odd minutes. I want to just present something that is being touted as a solution to this, but it is certainly not a solution at all, which is hydrogen blending, which may be something that you've heard of before, but if you haven't, I would love to tell you about it. So essentially what is happening is the gas industry is seeing the writing on the wall and it knows that it has to greenify their sector in any way possible, which is pretty hard when the entire sector is based on fossil fuels. So what they are proposing is to blend hydrogen gas into the methane gas supply to reduce the amount of methane that we need, essentially. This is not a great solution, however much they say it's better and cleaner, for two reasons in particular. One, it's bad for the climate. To get hydrogen gas in a form that is usable for us, it takes a ton of energy. And the majority of the energy is generated by combusting fossil fuels. So to offset fossil fuels, we need to use more fossil fuels. It doesn't make sense. So one, it will actually cause an increase in the amount of fossil fuels we need to extract. Next, despite what the gas industry says, it is actually worse for our health as well, because when you burn methane and hydrogen together, more NO2 is produced than if you just burned methane alone. So that dangerous gas that we just spent 45 minutes talking about that is causing asthma, that it shows that when you decrease it, you decrease the amounts of childhood asthma, more of that will be produced in our kitchens if we allow hydrogen to be blended into the gas supply. It's also more explosive than just methane alone. So there's, again, household accident risk as well. So long story short, let's not allow it. If you see it come up in your county or your local legislator is pushing this and saying that this might be a solution, a great time to go to a town hall and raise your hand and say, absolutely not. It's not what we need to do right now. And with that, folks, thank you so much for listening to me this evening. Before we jump to the Q&A, I do have another quick favor. If you could fill out and complete this post-test, just like you did the pre-test. It's the same questions. And as well, there's some, how do we do? 1 out of 5. What could we do better? What did you like most about this? Data, and your feedback is greatly appreciated. So again, I'll give us another 3 or so minutes if you could complete that Google survey, and then we'll come right back for the Q&A. Thanks so much. Alrighty, y'all. Before we get to the Q&A, I just want to give a little bit of a shout out to PSR and our chapters that are working on building electrification. Won't go through this word for word, but we've had some great city policy changes in Washington. We've had some PSAs on the NBC affiliate in Colorado. The Massachusetts Medical Society adopted a resolution and recognized the association between gas stoves and asthma. And we also have some folks in Philadelphia helping with home rehabilitation programs for the electric transition, because again, it's all well and good if we scream and shout about transitioning to an electric stove, but if you can't afford it, or if you can't do it in your building, what good is it? So again, kind of the systemic work as well. And next, I would also advocate for you to join PSR. If you're not already a member and you're interested in any kind of health professional, you don't have to be a physician. I would love for you to come and join us. And specifically, if this climate and clean energy issue lit a fire under your butt and you really want to get involved, I am about to drop in a link into the chat for our Climate Ambassadors project, where you would get to work hand in hand with PSR national staff on issues specifically geared towards climate change, renewable energy, and environmental health. So if that interests you at all, click that link and sign up to be a climate ambassador. And if you do want CME credit for this presentation, I'm going to drop a link into the chat real quick for you to go through and claim your CME credit. However, I don't think anyone here wants or needs that CME credit, so no worries at all. And thank y'all and stay safe. And let's jump right into the Q&A portion. So I see that we didn't have any questions during the presentation. I guess now, does anyone have any questions? You can drop them in the chat. You can raise your hand and, I'll unmute you and we'll have a conversation. Anyone have any questions? If not, that's totally okay too. No worries. I know it's late. Yes, Barbara.
Is this recorded and is it available to show to other audiences?
Yes, this will be recorded and the recording should process in about a day after this presentation. And then we will be posting it and sending it out to show other audiences as well.
Great, thank you.
Of course. Alrighty, folks, going once, going twice. All right, in that case, I must have been a brilliant presenter and answered any and all questions in my presentation that you could have possibly had. Thank y'all so much for joining us today. I'll stop sharing my screen right now, and I hope you have a wonderful, wonderful rest of your week and your night, and you'll be receiving a follow-up email from me with a couple of fact sheets as resources you can take home from this presentation to keep on your computer, print out, and keep in your kitchen, whatever you need to do with them. So thanks, folks. Thanks for a great evening, and I hope you all have a great rest of your night. Thanks, y'all.